grew up here in the state of Utah in a town called Springville, Utah. Springville is a great place to grow up. I played sports in high school, played basketball and tennis. There were 4 kids in my family growing up. I did my undergraduate school at BYU school. I went to Washington University in St. Louis, School of Medicine, so I spent 4 years there, and then did my residency at the Mayo Clinic in Minnesota, and from there went down to the Texas Heart Institute in Houston, Texas, and spent 4 years there doing cardiology and then interventional cardiology is where we treat blockages in arteries. There are fatty plaques that develop in arteries and in the arteries of the heart, but then also in other arteries that go to the neck or arteries that go to the legs. And one option, doing a balloon procedure, so we pass a small wire across the procedure and then balloon the plaque to the side of the artery, and then usually put in a stent, which is a metal mesh tube that holds the artery open. And this can interrupt heart attacks and prevent chest pain and treat chest pain, and then also can prevent stroke if we do it in the carotid arteries, or treat pain in the legs when there are blocked arteries to the legs. The most satisfying part of the job, I think, is when someone's having chest pain, they're in distress, feeling bad, and you can go in and open up the artery and restore the blood flow. You know, every patient is unique and complex, and a lot of people just say, well, medicine is just following a recipe and there are guidelines for every patient, but really every patient is unique, and every patient has unique circumstances, and no 2 patients are identical. And so finding out what is the best treatment for each individual patient is like solving a puzzle. In the past, cardiac disease was considered mainly a problem of men, but we actually know that women suffer from cardiac disease in the same numbers as men, and actually women are very likely to suffer from cardiac disease. One interesting thing is that women tend to have more unusual symptoms. Heart disease in women has been underappreciated and undertreated. And married with 4 kids, ages 3 through 9, 3, 5, 7, and 9. I'm a sports fanatic. I watch any sport that's on TV and know quite a bit about basically all the sports. We have better medications all the time. There's a new medication that blocks the effect of platelets that is a blood thinner. The stent technology and balloon technology is always improving. We can do things with smaller catheters, being less invasive. The fun thing about cardiology is that it's a technology-driven field, and as the technology improves, our ability to help patients and to help them feel better and get back to their life faster improves.